Welcome to the Nurse Perspective, where we delve into the vital intersection of healthcare, community, and public health nursing practices. In each episode, we'll explore a wide range of topics, from preventative care and health promotion to disease management and community engagement. We'll have special guests talking about specific topics near and dear to their hearts, and individuals with lived experiences, shedding light on the challenges and successes of public health. Let's meet the team, starting with your host.
Hello, my name is Jackie Haley, RN, and I'm the Clinical Section Manager at Two Rivers Public Health Department, and I oversee nursing and all things clinical.
Hello, I'm Jordan Anderson, Public Health Nurse RN, and I am Team Lead on STIs and immunizations here at Two Rivers.
Hi, my name is Rosa Piñon, and I'm a Public Health Nurse LPN here at Two Rivers Public Health Department, and my specialty is tuberculosis. I also speak fluent Spanish and English, so we are available if you need us.
Hello, I am Liz Weens. I'm a public health nurse, RN, and I am the lead nurse here at Two Rivers Public Health Department.
Hello, I'm Melissa Kissinger, Public Health Nurse RN, and I do immunizations and disease surveillance here at Two Rivers.
Whether you're a seasoned public health nurse, a healthcare professional, a student aspiring to enter the field, or simply interested in learning more about the critical role of nursing in public health, this podcast is for you.
Welcome back, and thanks for tuning in. I'm Jackie Haley, and today we will be talking about a couple different topics, but lucky you, we have no Health Alert Network updates from Nebraska Department of Health and Human Services. So no news on that, but we will have some updates from Two Rivers, and then we will be speaking with Melissa Kissinger on lice. So, on a local scale, we have been seeing pertussis within our district, and I know we've talked about that before, but just a little background, pertussis is a respiratory disease. It's easily transmittable, but thank goodness there is a vaccine for it. So make sure that you guys are up to date on your DTaP or your Tdap. That is a vaccine that it will vaccinate you against diphtheria, tetanus, and pertussis. So pertussis is something that does routinely go around, but we have every couple years where we have peaks of pertussis. We've actually been very quiet on the pertussis for the last couple years, so we have been waiting for this spike. We are seeing it within the Two Rivers district. We are seeing it in Nebraska, and we're seeing it throughout the United States. So if you have that tried and true pertussis whooping cough, make sure and get into your doctor's office to be seen, as an antibiotic will help you get rid of that and reduce transmission of that. Also, this respiratory season, we have been seeing influenza, RSV, COVID, and norovirus. Although all of our numbers are lower than average for the time of the year. So just remember that there is a vaccine for influenza. And if you don't have that, you can get it at Two Rivers or most clinics. RSV, there is a vaccine for children and elderly. So if you're eligible for that, talk with your doctor. And then COVID, there is a vaccine. We do offer that, and so do most clinics. And lastly, norovirus. So norovirus is that silly stomach flu where you've got nausea, vomiting, diarrhea. It is very transmittable, and you need to make sure that you are doing good hand washing with water and soap, because hand sanitizer will not kill norovirus. And you need to make sure that whatever chemicals you're using in your house to kill the norovirus, that chemical actually does work on norovirus. Most household things that you just get they don't kill norovirus. So make sure and read the label. Make sure that they kill influenza, RSV, COVID, and norovirus. All right, joining us now is Melissa Kissinger, Public Health Nurse RN here at Two Rivers Public Health Department, to educate us on lice. But before we get down to the nitty-gritty, tell us a little bit about yourself, Melissa.
Well, like you said, I'm Melissa Kissinger. I am the newest nurse here at Two Rivers Public Health Department, and I am on my learning curve. There's a lot of new things to learn, and so I'm not specializing really in anything yet, just trying to get to know everything about what we do here at Two Rivers.
Yeah, it's a lot, isn't it?
Yes, it is. It is a lot more than I imagined. I also have a passion for kids and have done foster care and worked in the shelter situation. And so that's where I started learning about head lice.
Yeah. I imagine you've come across that once or twice.
Yes, I have.
All right. Well, what is lice to start off with, Melissa?
So, the actual lice bugs are tan or gray insects. They're about the size of a strawberry seed, so they're very small. And they feed on human blood from the scalp. Their life cycle, yeah, exactly. Their life cycle begins as an egg and it hatches in 6 to 9 days. And then it's a nymph for 9 to 12 days. And then 3 to 4 weeks it spends as an adult. But the female louse can lay 6 to 10 eggs a day.
Wow, that's effective.
Yes, exactly. And typically those are attached about a quarter of an inch or less from the scalp by a sticky substance that they emit to stick it to the hair shaft.
Oh, that's why they just don't fall out, right?
Yes, exactly.
Awesome. So how do we detect for lice then?
If your child has symptoms of a head lice infestation, which is itching, and I know everybody's already itching their heads now, examine their head, especially behind the ears and at the nape of the neck for any crawling lice and for nits. Part the hair all the way down to the scalp into very small sections and examine for both moving lice and the eggs. If you find crawling lice or nits, you should examine everybody in the household every couple days and then treat anyone who has live or crawling lice or nits that are within a quarter inch of the scalp.
So when they're doing these checking the kids or anybody, I guess, for lice, can they spread it by checking for it?
It's very unlikely. In my personal experience, I've checked many kids that have head lice and have never taken it home. One myth about head lice is that they jump. They actually only crawl. They can't jump or fly. And so they're most often spread by direct head-to-head contact within a family or close contact at school or at play. Less commonly spread through hats, scarves, brushes, combs, hair accessories, headphones, pillows, towels, upholstery, those kinds of things. But I thought it was a good time of year to talk about it because we're going to be wearing our hats, and we all know that kids pull each other's hats off and share them. And so just that is one way to try to prevent it. Like I said, not as commonly spread that way, but it can be. Right. Pets do not play a role in spreading head lice.
Interesting.
Yeah, and because of the way that they're spread, they're most common among preschool and elementary school kids.
Yeah.
So those are our high-risk populations.
When I was a child, I got head lice, and it was after a sleepover. Mm-hmm. We all slept out in the tent, and we all decided to put our heads in the middle of the tent with our feet, out.
Of course.
So one of us had it and gave it to all of us, and I think the next day or two we left for vacation to South Dakota, and we found it en route because my mom was braiding our hair on the way.
Nice.
And she went from, I had 2 other sisters. She went from one of us to the next, and we all had head lice, so we all had to be treated while on vacation.
Oh, lovely.
So let's talk about prevention. So how do we stop the spread or make it so we don't get it?
It's really difficult to prevent the spread, especially in childcare facilities, schools, shelters, those kinds of places where people are in close contact. Like I said, the chance of spreading from item to item is slight. However, to prevent from head lice, you may want to tell your child to hang their clothes or their coats on a separate hook from other kids. Don't share combs, brushes, hats, scarves, and not to lie on somebody else's bed, couch, pillows if they know they've had head lice.
Right. I mean, you can get lots of things from any kind of contact. So
to try to stop the spread, though, if you know you've had head lice or your kid has had head lice, some things to do. They don't survive very long if they're off of the scalp. So one drops on the carpet, it's really not probably going to cause an infestation for someone else just because they don't survive that long. But machine wash and dry all the clothes and bedding that the person who was contaminated used in the 2 days before treatment. If possible, use hot water and high heat drying. If they can't be washed or dry cleaned, then tie them up in a plastic bag for 2 weeks. I always tell people to tie them in 2 plastic bags just to be sure. Soak the combs and brushes in hot water, and it needs to be at least 130 degrees. Soak those combs and brushes for 5 to 10 minutes.
And make sure your water is at that 130 because with the anti-scalds, a lot of hot water coming out of your sink is 120 degrees or less.
Exactly.
So you might need to boil that water for a little bit.
Get it good and hot. Even though the chance is pretty slim if a lice has dropped onto the carpet, we still recommend that you vacuum the floor or the furniture, especially places that infested person frequents. The CDC actually does not advise the use of the fumigant sprays or fogs due to the toxicity if those were inhaled or absorbed through the skin. So
because that could be a bigger deal when they're little kids.
Yes.
Their little skins absorb way more than us old people that have rough skin.
Exactly.
So what other treatment of the infested person or people are there?
There are both prescription and non-prescription treatments. Some of the treatments just kill the live lice and others kill the eggs and the lice. So when you're completing a treatment, just make sure that you're following the package instructions carefully. If you don't leave them on long enough, it may not kill the lice. Leaving them on too long can increase the adverse reactions because these are chemicals and they're killing something else that's living. So they can be dangerous if you leave them on longer than they're supposed to. You also shouldn't use shampoo or conditioner or a shampoo-conditioner combination or conditioner prior to the application, and you shouldn't wash your hair for 1 to 2 days after the application of the treatment. Although there's not scientific evidence that suffocating head lice with mayonnaise, olive oil, margarine, butter, or those kinds of things are effective, these are treatments that I've used with success in the past. I actually had a kiddo that had kind of a super lice, and she had been treated so many times at home that the lice, it just didn't faze them to have those chemicals put on them anymore.
Interesting.
And so with her and with all the kids that I treated when I worked in a shelter, we used the mayonnaise trick. We just slathered their hair in mayonnaise, wrapped it in saran wrap, and then put a towel over it. And we always left it for 2 hours just to make sure that we killed whatever might be living there. And then you want to make sure that you use a very fine tooth knit comb. The metal ones are actually better than the plastic ones.
Right.
And if you don't understand where the term nitpicking comes from, after you're finished with this, you will understand because it is a very tedious process, and you need to do it every couple of days in order for it to be effective.
Wow.
So just making sure.
Does it matter what kind of mayonnaise? Like, are we talking like real true mayonnaise, or could it be Miracle Whip, or does it matter?
I always just got the cheapest mayonnaise and the biggest jar I could find.
Oh, there you go.
And just plain old mayo was what I always used. Another thing is that vinegar can help to release some of that sticky that they use to attach the nits to the hair shaft. And so I always dipped my comb in vinegar and then combed.
Oh, there you go.
If you notice a few live lice moving 8 to 12 hours after treatment, you don't need to reapply. A lot of times it'll just kind of slow them down, and then they'll eventually die. If you don't find dead lice after your treatment, then it might not have been effective on the lice. So that would be a time to talk to your healthcare provider about retreating. If you can't find a good lice comb, there are flea combs that are made for cats and dogs, and those are pretty effective.
Oh.
It just the teeth need to be very close together because these are very tiny.
Right.
And when I'm doing it, I always just divide the hair into the little sections, comb through it, and I look. And if I still see one, I might just try to pick it off.
Right.
Just making sure that we get it all.
So are those combs that you're talking about, are they reusable?
Yes, you can sanitize them and reuse them. I had one comb that I used for a very long time when I was doing this. I would just boil it, plastic bag it, and keep it in my office.
Oh, there you go.
But you do need to continue to do nit removal every 2 to 3 days for 2 or 3 weeks after the infestation. So very important. Excuse me. Very important to get those removed.
Yeah.
There are some schools that still have a no nit policy. However, the CDC and the American Academy of Pediatrics and the National Association of School Nurses advocate to get rid of those policies, because if there's nits that are more than 1/4 inch from the scalp, they're really unlikely to ever hatch and become live lice.
Oh, okay.
They may actually be empty shells that are still stuck there.
Interesting.
And nits that are actually on the hair shaft are very unlikely to cause anyone else to get infected. So we don't want to cause unnecessary days off of school. It's also very common for someone to be misdiagnosed with head lice. They might have a little dandruff. They might have been playing in the sand and have light colored sand on their head, and somebody looks at it and mistakes it for some nits. So if you do want to be diagnosed officially, you need to go to the doctor and have them look at it for sure.
Yeah, absolutely. So are there any other interesting facts about lice?
Well, earlier I kind of alluded to the super lice. And like I said, these are lice that just don't respond to conventional treatments. They don't respond to the chemicals. They've been hit with those chemicals so many times that they have just become immune to them. The girl I was talking about, she had very long hair. Her family had cut her hair very short to try to get rid of it. They had treated her over and over and over again and just never could get rid of it. And we were able to successfully get it under control while she was with us. So,
wow.
Yeah.
And is there ever a need to shave the kid's head?
No, never. It makes it easier to get it out, but we really have to look at risks versus benefits, and it can be so detrimental to a kid, especially a girl who treasures their hair. It can just hurt their self-esteem so drastically by doing that. So
I once had a little girl in the hospital that come in with her hair all buzzed off because she had head lice, and she was the most adorable, beautiful little girl, but she would put clothes on her head. And so she would have like her shirt on her head or her underwear or anything that would fit on her head so she could feel like she had hair again.
Right.
And it was just the cutest little thing ever. But also kind of sad.
Yeah,
So
exactly.
that's good to
Exactly.
know for everybody.
Yeah.
So, all right. Well, thank you for joining us, Melissa.
Thank you so much. I
Great
look forward to
talking.
doing it again.
Yes, yes. So, thank you guys for joining us. Next time, we will hear from Rosa Pinion, who's a public health nurse LPN, and she will be educating us all on National Cervical Health Awareness Month, along with our medical updates, both nationwide and right here at home. Thanks, guys.
Thanks for joining us. Check back in with us next time for more of the Nurse Perspective.